common inhalants are in medical practice? The answer might surprise you. Inhalants are an integral part of many medical procedures and therapies. They are drugs or substances that are administered by inhalation, either through the nose or mouth, and they produce either a local or systemic effect. From the operating room to the dentist's chair, inhalants are ubiquitous in medicine. Now, inhalants come in a variety of forms, and they can be classified into 4 main categories. First, we have gases. These include oxygen, nitrogen, carbon dioxide, and nitrous oxide. Each has its own unique application in medicine. For instance, oxygen is often used in respiratory therapies, while nitrous oxide is a common anesthetic. Next, we have volatile solvents. These are substances that easily evaporate at room temperature. Common examples are gasoline, paint thinners, and even nail polish removers. While these might not seem like they have a place in medicine, they can be used in certain therapeutic applications. The third category of inhalants is aerosols. These are sprays that contain a propellant and a solvent. They're often used in respiratory therapies, particularly for patients with conditions like asthma or chronic obstructive pulmonary disease. Lastly, we have nitrites. These are organic compounds used as vasodilators. Examples include amyl nitrite and butyl nitrite, which are used to treat conditions like angina pectoris, characterized by chest pain due to reduced blood flow to the heart. Now that we've classified the different types of inhalants, let's delve deeper into their medical applications. Nitrous oxide, for example, is often used as a dental anesthetic due to its analgesic and sedative properties. Ether, on the other hand, is used as an anesthetic during surgical procedures, providing rapid induction and recovery. Alkyl nitrites, another type of inhalant, are administered to treat angina pectoris. In conclusion, inhalants play a crucial role in medical practice, offering effective means of anesthesia, pain management, and respiratory support. Their diverse properties and applications make them valuable therapeutic agents. Whether it's providing relief from chronic respiratory conditions or ensuring a pain-free dental procedure, inhalants are an indispensable part of modern medicine. So next time you're in a medical setting, you'll know a little more about the role these substances play.
Have you ever wondered why we need oxygen? This seemingly simple gas is a cornerstone of life as we know it, playing a crucial role in many of the processes that keep us alive and thriving. Oxygen, symbolized as O2, is a vital component of the air we breathe and the water we drink. Constituting approximately 21% of the Earth's atmosphere, it is stored in compressed form in metallic cylinders. Let's dive in a bit deeper. Oxygen is a colorless, odorless, and tasteless gas. It has a neutral appearance and is soluble in water and alcohol under normal pressure and temperature. But don't be fooled by its seemingly benign nature. Oxygen is the life of the party in the world of chemical reactions, acting as an oxidizing agent. It loves to interact with elements like carbon, sulfur, magnesium, iron, and phosphorus, forming various compounds. Let's take a look at a few examples. When oxygen meets carbon, they form carbon dioxide. When it encounters sulfur, they turn into sulfur dioxide. Magnesium and oxygen create magnesium oxide, while iron and oxygen result in iron oxide. Phosphorus and oxygen, on the other hand, end up as phosphorus pentoxide. Storage of oxygen requires some precautions. Oxygen cylinders are typically stored in a cool room, away from inflammable materials. The cylinder is marked with a white shoulder, and the name or symbol O2 is distinctly displayed. Now you might be wondering, why is oxygen so important to us? It's simple. Oxygen is essential for respiration. It's what our bodies use to turn food into energy. Without it, our cells wouldn't be able to function and life as we know it wouldn't exist. But that's not all. Oxygen is also administered in various medical conditions. It's used in the treatment of hypoxia, unconsciousness, and serious conditions. It's crucial for post-operative care and anesthesia. It's also used in the treatment of anoxia, asphyxia, burns, shock, asthma, and even circulatory failure and poisoning due to gases like carbon monoxide. And it's vital for individuals working in pressurized spaces or dealing with infections. In conclusion, oxygen, this humble and ubiquitous gas, is a lifesaver. It's a key player in the chemical world and a vital resource in the medical field. Without it, life as we know it would cease to exist. So the next time you take a deep breath, take a moment to appreciate the oxygen that makes it all possible.
Have you ever pondered over the significance of carbon dioxide, or as scientists like to call it, CO2, in our day-to-day lives? Well, you're about to find out. Carbon dioxide, or CO2, is a chemical compound consisting of one carbon atom and two oxygen atoms. It's a gas at room temperature, making up about 0.03% of the air we breathe. But it's not just in the air, it's released from volcanoes during the decay of organic matter, through combustion, fermentation, and even our own respiration. Physically, CO2 can exist in three states: as a gas, a liquid, or a solid. As a gas, it's colorless and odorless. When it's compressed and cooled, it becomes a heavy, colorless liquid with a faintly acidic taste. And in its solid state, it's a white substance known as dry ice. Chemically, CO2 is quite fascinating. It can be created by reacting acids with certain substances, or by heating carbonates of heavy metals, or bicarbonates of alkali metals. When it reacts with lime water, it forms calcium carbonate. But where is CO2 stored? Well, it is typically stored in metallic cylinders, kept in a cool, inflammable-free room. And these cylinders are often painted gray or green to distinguish them. So what do we use CO2 for? Well, it has a variety of uses. In the medical field, it's used as a respiratory stimulant and cardiovascular center stimulant. When used in low concentrations up to 10%, it can be used for therapeutic purposes. However, higher concentrations can lead to respiratory depression, convulsions, and can even be fatal. It's generally administered by inhalation in concentrations of 5% to 7.5% mixed with oxygen. So, to summarize, carbon dioxide is a versatile chemical compound that occurs naturally in our environment and has a variety of uses. It's a gas at room temperature, but can become a liquid or a solid when cooled and compressed. It's used in the medical field as a respiratory and cardiovascular stimulant, but it's important to remember that in high concentrations, it can be harmful. So next time you hear about CO2, remember, it's not just something we breathe out, it's a substance that plays a vital role in many areas of our lives.
Have you ever wondered why nitrous oxide is called laughing gas? Well, the answer lies in its chemical and physical properties, which we're about to dive into. Known to many as laughing gas, nitrous oxide, or N2O for short, is a compound that can induce a sense of exhilaration when inhaled. This is why it's often administered with a 20 to 50% oxygen mix to prevent rapid hypoxia, a condition caused by insufficient oxygen. This gas, though colorless, may surprise you with its slightly sweet aroma. It's nearly odorless and completely tasteless, but don't let its lack of color and taste fool you. Nitrous oxide is soluble in alcohols, solvent ether, and even sulfuric acid. Now, nitrous oxide isn't just any ordinary gas. It has some unique chemical properties. For example, when you heat it above 300 degrees Celsius, nitrous oxide decomposes into nitrogen and oxygen. And when it passes over red-hot copper, it reduces to nitrogen. Fascinating, isn't it? As for storage, nitrous oxide is typically stored under pressure in metallic cylinders. You'll recognize them by their blue and black paint job with the NO symbol and name prominently displayed on the cylinder's shoulder. But why do we need nitrous oxide? Well, it's actually used quite extensively in the medical field. It serves as a general anesthetic and an analgesic in surgery and dentistry. It's also used in minor operations and to calm excited mental patients. So, to summarize, nitrous oxide, or the laughing gas, is a colorless, almost odorless gas with a slightly sweet aroma. It decomposes into nitrogen and oxygen when heated above 300 degrees Celsius and reduces to nitrogen when passed over red-hot copper. Stored in pressurized metallic cylinders, this gas plays a crucial role in various medical procedures, making it an essential part of our lives. Who knew that a colorless, tasteless gas could be so interesting? So, the next time you come across nitrous oxide or hear about the laughing gas, you'll know exactly what it is and why it's so important. And that, dear listeners, is the magic of science.